Hello everyone. Today we will study one of the most important topic of low frequency current, that is Faradic current, and it is also important in day-to-day practice of physiotherapist in different aspect. Faradic type of current. Okay, Faradic type of current. In Faradic type of current, we'll study firstly about the definition of Faradic type of current. So, definition. Definition. Uh, Faradic type of current is a short duration current okay no short duration 1 minute. Short duration interrupted direct current. Direct current with the pulse duration of point 1 to 1 millisecond and millisecond and frequency of 50 to 100 hertz. Okay, so Faradic type of current is a short duration interrupted direct current with the pulse duration of zero point 0.1 to 1 millisecond, and the frequency ranges from the 50 to 100 hertz. Okay, now we'll know the types of Faradic type of current. The Faradic type of current basically has two types. Uh, जो therapeutic Faraday current classified as two types. Number one, plain Faraday type of current. Plain Faraday current. What is the plain Faraday current? Which includes single stimulation with no interruption. With no interruption. Okay, with no interruption. So, and number two is surge Faraday current. The mostly used SURGET G surge SURGET surge Faraday current. What is surge Faraday current? It is interrupted therapeutic current. Therapeutic current. And uh, and it is also known as modified Faraday current. So, modified Faraday current. So, what are the types of Faraday current? The therapeutic Faraday current is classified as two types. The two types includes number one, plain Faraday current. The plain Faraday current, which includes the single stimulation with no interruption. There will be no interruption in any type of stimulation. Is the plain Faraday current. Number two is surge Faraday current. It is the interrupted version of the Faraday current, and it is interrupted therapeutic current, and it also known as the modified Faraday current. Okay. Now we know the uh, physiological effects of Faraday type of current. What are the physiological effects? Physiological effects of Faraday type of current. Number one is 1 minute student. Number one is effect on the sensory nerve. Effects on sensory nerve. Number two is effect on the blood vessels. Effects on the blood vessels. Number three will be the effects on the innervated muscle. So what is effects on innervated, INNER, innervated muscles? Now, what are the innervated muscles? Means where there is intact nerve supply, that is known as the innervated muscles, and there is any cut-offs of nerve supply in the muscles is known as the denervated muscles. Okay, so it has effects on the innervated muscles. And next, number four, effects on denervated muscles. Denervated muscles. Effects on innervated muscles and effects on denervated muscles. Number five is effects on muscle contraction. Contraction. So these are the basic physiological effect of FARADIC type of current which use in our day-to-day physiotherapeutic treatment. The details of this physiological effect, we have to study the details lately. We will study it lately. First of all, we will know the basics. Then we will study the deep portion of the FARADIC type of current. The physiological effects, main physiological effects are the five. Effects on the sensory nerve. Those are the sensory nerve. They have effects on sensory nerve, effects on the blood vessels, effects on the innervated muscles, effects on denervated muscles, and effects on muscle contraction. Okay. Now next we'll study about the therapeutic effect. Therapeutic effect. In therapeutic effect, number one is strength training. Strength training. Number two is the re-education of the muscle activity. We will study details of this therapeutic effect after later on in another video. These are the we'll study in this video about the basics of the therapeutic effects. What are the basics of therapeutic effect? First one is the strength training. Next one is the re-education of muscle activity. Re-education of muscle activity. Next one is edema control. We'll study later on in the what is edema, what are the effects of the FARADIC type of current in edema control. We'll study later on. Number 4 is the maintenance of the range of motion. Maintenance of range of motion, shortly known as the ROM. Next is the temporary control of spasticity. Temporary control of spasticity. We'll study it, the details later on. Okay, I will in this video I will give you only the brief idea of the FARADIC type of current. Next, after the therapeutic effect, we will know about the indication. What are the indication of FARADIC type of current? Indication of FARADIC type of current. In indication, number 1 is deltoid. Deltoid is one of the muscle of the upper limb. Deltoid and quadriceps inhibition, and quadriceps is lower limb muscle, and QUA QU deltoid and QU quadriceps inhibition. Okay, next one is the 1 minute flat foot. What do you know as the indication? Indication means where we use the FARADIC type of current, that is known as the indication. So number 1 is the deltoid and quadriceps inhibition. Next one is the flat foot. Flat foot. Next one is compression of peripheral nerves. Compression of peripheral nerve, that is also known as the neuropraxia. I will also know details about the neuropraxia. What is neuropraxia? What is axonotmesis? What is neuronotmesis? That is the standard classification of nerve injury. We'll also know because in FARADIC type of current mainly used in the nerve injury cases. So we'll also know. So here is what the compression of the peripheral nerve is known as the neuropraxia. Okay. Next one is the post-traumatic disease atrophy. Post-traumatic disease atrophy means where you have trauma due to external injury. Traumatic, post-traumatic disuse atrophy. Disuse means non-use of the muscle. Disuse, that is known as the disuse. Atrophy means wasting. TROPHY. Disuse atrophy of any of the skeletal muscle. Post-traumatic, after any trauma, external trauma, there you are not using your hand or feet, then the unused hand or feet will become the disuse atrophy. Atrophy means wasting of that muscles. And next is number 5 is lymphedema or lymph edema separately and jointly known as a lymphedema. Lymphedema. Next is reduction or reduced range of motion of the joint. ROM, that is range of motion of joint. Next one is the stress incontinence or weakness of the pelvic floor musculation. Stress incontinence is also known as the stress incontinence, that is the weakness of the pelvic floor musculature. And next one is the spasticity after stroke or CVA, and stroke or also called as CVA, and 1 minute, and any spinal cord injury. Okay, so these are basics, the indications of the FARADIC type of current. Number 1 is deltoid and quadriceps inhibition, but there is deltoid muscles and quadriceps muscles inhibition is occurs. There we can use the FARADIC type of current. Next one is the flat feet. It is also known as the pes planus. Flat feet is also known as pes planus. The feet is flattened. Next one is compression of the peripheral nerve. Any compression, either it may be in the brachial plexopathy or in the distal portion where there is compression occurs, that is known as all the neuropraxia. The FARADIC type of current used. Number 4 is the post-traumatic disuse atrophy of the skeletal muscles. Next one is the lymphedema and reduced ROM of the joints and stress incontinence. What is stress incontinence? That is the weakness of pelvic floor musculature. Okay. Next one is spasticity after severe stroke. Severe, another term is known as the stroke, and the spinal cord injury. Okay. Now these are the indications or where we use FARADIC type of current, and where we cannot use, that is known as the contraindication. Okay, that is why we use is known as the indication. Why you can't use this, that is known as the contraindication. These are also important. Okay, contraindication where sensation loss, the where there is any sensation loss, you cannot use FARADIC type of current. Now, metastatic tumor. The cancerous tumor, metastasis tumor or cancerous tumor. And number 3 will be the cardiac pacemaker or pacemaker. Okay, where there is cardiac pacemaker implanted in the uh, patient, you can't use FARADIC type of current. You have to avoid the use of the FARADIC type of current. Number 4 is the DVT. DVT is also known as the deep vein thrombosis. Number 5 is hemorrhage. Hemorrhage is also known as the bleeding. Next one is the active TB, but TB is active, means persist in the patient body. That is the active TB. So where was I? Number 6. Number 7. Epileptic patient or epilepsy. Number 8 is open wound. Where there is wound is open, you can't use. And next one is the any metallic implant or any you can say metal is implanted in superficial area of the body. In case of post fracture, you can't use. That is metallic implant. You can't use in case of metallic implant. Number 10. You can say next one will be epilepsy. So epilepsy, open wound, metallic implant, and in case of unconscious patient, the patient is not conscious, you can't use. In case of unconscious patient, you also can't use. Okay. Number 11 is, but there is non-union of the fracture. Next one will be the acute inflammation. So in these cases, we can't use FARADIC type of current. Okay. In my next video, I will study details about the 1 minute. Details about the physiological effect, which is most important in FARADIC type of current. In my next video, details about the physiological effect and details about the therapeutic effect, which most examination from these two topics the year comes. So thank you.